I've been researching and designing photobiomodulation and laser therapy equipment for the last 15 years.
Well, welcome to TAC Tic Talk. This week we're here with Dr. Ryan Novak, and I'm joined with Jaclyn Dr, my sister and publisher of the American Chiropractor magazine. Dr. Novak, welcome to TAC Tic Talk.
Yeah, thanks for having me.
Tell us a little bit about your background. I was looking over your CV and noticed that you graduated from Palmer, and you also did a naturopathic degree in National University of Health Sciences. How did you get into conservative healthcare, and what is it about that got you into it?
Yeah, for sure. I mean, I have a long history in conservative healthcare. I've been under chiropractic care since I was probably about 7 years old, I would say. Typical chiropractic story or chiropractic family story. My brother was dealing with asthma. Someone recommended my mother and father take my brother to a chiropractor, and within 6 months he was off all his inhalers and doing great. And we never stopped chiropractic care after that. And then since I was about 12 years old, I always wanted to be a chiropractor after seeing how happy the patients were at my chiropractor's office. And that's kind of been the journey and the story. So it's always been there since I was younger. And just continued it and continued learning more and more and into natural medicine and things like that.
So when did you graduate from Palmer?
Yeah, I graduated from Palmer in 2008, and I primarily started doing, I'm certified in a couple different upper cervical techniques. So I actually was practicing primarily upper cervical chiropractic in the Chicago area for a few years. And then I got introduced into laser therapy, photobiomodulation, and then kind of wanted to expand my scope. So then that's when I went into like the naturopathic training. And then I went into getting injectable training in Oklahoma, one of the states where you could do different injectable procedures as a chiropractor. Obviously, it seems conflicting almost as an upper cervical chiropractor, more straight-minded mindset, and then going into the extreme. Yeah, the extreme. But it was just, to be honest, it was always about just helping family members and helping patients. And when we started seeing these other treatments just synergistically working with upper cervical chiropractic, it was amazing. So I couldn't see practicing without those treatments after seeing how well they worked.
Well, that's very interesting. Now, they don't allow injectables, I think, in Illinois, correct? Which you said you were in Chicago originally, which...
Yeah. So they did for a while. It's not... Technically, the scope is without drugs or surgery, operation surgery, it kind of says. It's a weird verbiage. So we were able to do injections, buying office use only for a while, buying from the pharmacies, but then the FDA kind of shut that down in, I think, 2011. So then that's why I pursued the other education and the other certifications to do the injection.
Chicago, were you working with Dr. Dickholz or whatever? I mean, I think he's up in that area, right? So, because that was during the blood pressure study and whatnot.
Absolutely. Yeah, that was huge for a while. No, I wasn't working with him, but I knew of him and referred some patients up to him. He was way on the north side. I was on the south side. He was probably a Cubs fan. I'm a Sox fan.
Oh, there you go. So that's the division right there. So
yeah, for sure.
So now, do you continue to practice doing the upper cervical to this day, or?
I do on some specific family members and some patients if they come around, but I'm primarily focusing on developing laser and photobiomodulation equipment. And I do some injectable training and workshops still, just because it's a big interest to me.
Wow. So now I was going to say, I wanted to just jump in and see, to bring you to current, because we're going so much over how you got here then. So that's what I wanted to find out is now you've been contributing to the American Chiropractor as a columnist as well. And we've been following all of your great work you're doing too. So we wanted to find out about some of the articles you've been writing and tell us a little bit about the topics you're covering and what's been getting the most response.
Yeah, for sure. So obviously, as we were talking earlier, we've had really good response with these stellate ganglia block or laser block. So in the medical world or standard of care, they do a injection block over the stellate ganglia on the anterior neck for a lot of, sympathetic overdrive conditions or states, but you actually could accomplish a very similar effect using a laser, doing a laser block in that area. So, as chiropractors working on the nervous system, they were very interested in that article and didn't realize that you could do a treatment like that. You could also accomplish the same thing treating over like the trigeminal ganglia with people that have trigeminal neuralgia, and it's quite interesting. A lot of the laser procedures and advanced protocols are primarily coming from overseas, as you probably know, Joe. And they're kind of blocked in the U.S. So then when you give some of those, I guess, clinical pearls that are available worldwide, it's chiropractors in the U.S. are kind of starving for them because once they apply it and see how well it works, it's pretty amazing to see.
Well, so throughout the years, I've seen a lot of, in different classes for, say, acupuncture with laser and whatnot. But, they never really addressed the stellate ganglion. And it's very impactful when you're doing the dissection of these nerves, in gross anatomy as you go through the chiropractic program.
For
And they
sure.
are superficial, so it makes complete sense to use that as a tool. Can you explain some of the research that they've found historically on that, or is there anything you can point to saying a
Yeah,
demonstrable effect?
I could maybe pull something up real quick here. Some of the biggest studies were done in Japan, like in a hospital, and I think it was in regards to, let's see what is in regards to, a lot of it was in regards to like cardiac arrhythmias, where they're actually
Hmm.
controlling, cardiac arrhythmia by treating the stellate ganglia, and it goes back from the early 1990s, and then even now into 2021, they're coming back in U.S. studies, post-COVID type stuff. Hey, we could do this with laser and actually get things under control without doing a surgical procedure or
Which is a mind-blowing realization, right? That
yeah,
phototherapy, which has been like a chiropractic, wheelhouse from the beginning, is now you've got these lasers that can affect it. Now, does it have to be specific wavelength, or how do we determine, which is the best, or can it just be infrared or blue light? Some people will say, and
yeah, like that's the in the laser world or phototherapy world, like you're saying, it gets very complex because there's usually most of the research studies will end with, we don't know exactly how it's working, and we're going to have to do more studies to find the exact dosages and parameters and things like that. But it seems most of the studies for the stellate ganglia we're using infrared lasers, so anywhere from 780 to 1064.
mhm.
1064 is getting more popular. Um, 1064 Q switched ND YAG laser, or like a 905 gallium arsenide laser, like our portable PainBuster laser. Those seem to be hand in hand the deepest penetration, and it's based on how fast you're pulsing the light energy. So most of the laser energy, or most of the laser research, is now coming to, okay, if we pulse it with high peak powers, then it almost kind of like photo bleaches the skin, and then the penetration is deeper. But anywhere in the infrared range, you're going to probably get pretty good results as long as it has the right power output.
Okay. So now we met you from because I've been looking for someone to be a great author for all this laser type of intervention protocol for
Here you
years,
are.
but no one wants to write on it. No one wants to write on it. They're all like, they won't touch it with a 10-foot pole, and they don't want to say much. But I mean, now here you're coming with the actual studies. When in this stellate ganglion article you wrote in March of 2024 here, uh, I mean, you got about 4 references there just for that article that you wrote. So no, I'm super excited to have you. Now, you do work with a specific brand of lasers. Can you tell us a little bit about that, Dr. Ryan?
Yeah,
What
for
it,
sure.
what is?
So we got introduced to a manufacturer out of Israel probably in 2017. So we were developing our own photobiomodulation equipment since probably around 2013. We were doing a lot of aesthetic treatments actually in Chicago, and then started developing our own equipment, and then we got connected with this Israeli manufacturer that was doing more so pain specific lasers. And what we found out eventually is that they're actually one of the, kind of the original inventors of these types of technologies back in the 90s. So their scientists are they're very smart, and go way past my head in their understanding of how these different technologies work, and with the pulsing and the frequency layering and how you could focus the light and laser energy. So our handheld lasers that we promote or distribute in the U.S. are 905 gallium arsenide super pulse lasers, and they follow the guidelines according to like the World Association of Laser Therapy for 905 gallium arsenide. And like if you look on the World Association of Laser Therapy, they have two different guidelines: 780 to like 850 nanometer for infrared, and then they have the 904, 905 gallium arsenide super pulsed, or they say nanopulse laser. And that's what type of laser ours is. Not saying one's better than the other, it's just they have different dosage guidelines. I always tell chiropractors when I talk to them every week, I'm like, all laser therapy work as long as it's modulated correctly and you know how to use it.
Mhm.
There's some really junk out there on Amazon that I wouldn't suggest anyone to use, because usually the specs are incorrect.
Mm.
So definitely always go with a professional brand, so you know that you're getting something that's been tested and
Mhm.
laser reports submitted to the FDA, and you're getting actually what it says it is.
So with the super pulsed and the pulsed, I mean, there was a lot of information on that say that it gets deeper
Yeah.
versus superficial. Is that substantiated in your experience, or I mean, how
Yeah,
does that, or is it
there's
just a marketing? I don't know. I'm
No, yeah,
curious.
that's a great question. I had the same questions initially too, and tested a lot of different devices. And definitely when you pulse, for sure, when you pulse a laser, whether it's super pulse, just meaning, you know, the definition of super pulse isn't necessarily that it has to be in the nanosecond range, that the pulse width is super fast in the nanoseconds. It could still be in the microseconds, but um, definitely all the new research, even if you find on like high intensity lasers or class 4 lasers, the higher peak power, and the it usually a lower average power, so you don't cause a thermal overload in the tissue, will allow you to get deeper penetration. And there's even some studies in Europe showing where they're doing laser under ultrasound. I don't know if you've seen that yet, Dr. Joe. So somehow they're able
Yeah.
to pick up and see if you pinpoint structures, and doing laser under ultrasound, pinpointing like facet joints in the spine. So we didn't think it would ever penetrate that deep. And most research in the US says that it doesn't penetrate that deep. And that's always the debated question. Does it penetrate that deep? I don't know, but
Well, it's a great question because some people will say that you should be doing it for concussion and post-concussion recovery. So, I mean,
for sure.
do you have a lot on that, um, or have you got
Yeah,
a lot of experience? Because I mean, like literally, there's a book on that. Like a very well-read book.
absolutely. No,
So,
yeah. I mean, so research out of Germany definitely has proved that, in the 810 to 1064 range, it definitely penetrates the skull. Um, and then in regards to, like you're saying, yeah, just there's a story. I mean, this is crazy. I'm debating whether to tell this story, but so a
tell it. Just
colleague, yeah, a colleague had a patient that had a non-union C1 fracture, and he hit his head on a windshield in a car accident. Had a CT scan. The neurosurgeons wanted to fuse the C1 to the skull, to the cranium, and the patient didn't want to do that. So then someone said, "Hey, go to my chiropractor. He uses lasers and things like that. Maybe he could help you." And then this doctor out in California, great guy, a great colleague, he sent me these before and after CT scans 7 weeks after using the laser. So he told the patient to use our handheld laser for 7 weeks. He just came up with this protocol from his experience, but he said 7 weeks, use it twice a day, scan suboccipitally. I forget how many minutes he said to scan, but it the C1 didn't fuse after 6 months, initially, and nothing was working, and it looked like he was needing the surgery. But then he did 7 weeks of laser therapy. They redid a CT, and the atlas
Hmm.
completely healed. So was it the blood flow increase to the area that caused the healing and bringing in the growth factors and increasing the cellular mechanisms in that area, or was it actually were we getting penetration that deep? I don't
And
know.
yeah, that's very, very interesting, right? Especially considering the emergence of like people who are working on ACL tears and full tears for ACL
Sure.
recovery, the surgery. I
Yeah.
mean, the implications there are phenomenal, and I know that some of these ACLs are recovering as well. So
Yeah.
just would be an interesting study. So class 3 versus class 4. Um, What's your take on it? I mean, every time I ask a guy, he's like, it's a fire hose versus a garden hose.
For sure. Yeah, that's the debate. You know,
Is it
in
getting kind of effect, the phototherapeutic effect, or is it just thermal for a class 4? I
for the
mean,
class four. Yeah, like so we've been testing a class four where it just deals with the average power, as the higher average power depending on the safety that the FDA classifies the laser at. So if it's a higher average power, like above 500 milliwatts, you start getting in the class four range, or definitely above
mhm.
1 watt average power where it's on all the time. So we've been testing a class four where we could pulse it really high peak power, like 250 watts, but do a very low duty cycle so that the average power is really low, so we don't cause thermal overload in the tissue. And we could pinpoint it on the actual anatomical location to see if we could get kind of a faster response, like you're saying, with instead of a class three, get a
Mhm.
faster, stronger response. And it seems like we are, but I wouldn't throw out the handhelds either, because we've seen some amazing things just with the handhelds, and the research in Germany and Russia backs up using the lower powered lasers. And I think it's working. Um, like mesotherapy. Like when you're doing like little injections underneath the skin, like that's like a European technique.
Stimulating response kind of thing, right?
Yeah, yeah. So I think something like that's going on. It's just the cellular modulatory response going on that's causing, you know, healing the communication in the whole system and area. So it's neat,
So
neat stuff.
now I know you do the handhelds, right? Because you do the PainBuster, which
Yes,
listeners can learn more at painbusterpro.com. But
yes,
now, are you working on a class 4, or is one already in the
yeah.
market?
We
I'm not aware
we
of.
have one already done, and we have some colleagues already testing it.
Mhm.
So it's
Okay,
it's
but it's
it's
not for production.
available.
Oh, okay.
It's yeah. If they want to call and want more information, most practitioners like to start with the handheld. And as you know, there's only about like 20 to 30% of the profession that are using lasers right now, which should be our goal is to make it 100%. That's why we put those handhelds at a really amazing price into the market space. Just because every chiropractor should have a laser. You could do, even if you just do vagus nerve stimulation with the laser, like the stellate, where you could find
Mhm.
those points very easily, or just treating like the target blood supply to an area. It's very simple and easy to implement a laser.
I think your background with the upper cervical makes you much more open to say like how such a subtle technique can have such a profound impact.
For
So
sure.
for some people, there's that bridge to gap, right? But once
Yeah,
you see it, then you can't. It's like
you can't go back. Yeah. I
exactly.
mean, the amount of patients and family members that we've helped with laser therapies where I would just ship them a laser and I'm like, hey, do this protocol. I mean, it's crazy what you could get just with a handheld laser if you know what you're doing with it. And then it doesn't limit you to treat your patient or your family member that's in maybe California and you're in Illinois, or they're in Florida and you're in New York or something. You could get them that laser and then
Mhm.
show them how to use it, especially
Now,
with Zoom or something like that.
I have to jump in and ask. Now, does this then end up replacing chiropractic traditional care? Or you know what I mean? Obviously,
Yeah.
if the laser, like if you start to see where the investment of time and energy and resources, does it end up replacing it or just complementing it? Is it just kind of dividing up, based on the cases where you start to realize which ones need which? Or do you find that laser kind of trumps,
Yeah.
anything else? Or how do you have,
You're definitely asking the toughest questions for sure there, Jaclyn.
well, you got a bias, of course, but I'm just
Yeah.
checking because I know for our listeners as well, because some people, I mean, there's definitely a huge philosophy where if it's not chiropractic, then, then they might shut off a little bit. But then
Yeah.
there's also,
No.
you know,
And I understand that. Like I said, I mean, I was an upper cervical guy. So Dr. Joe knows if I was doing upper cervical, I mean,
It's in you.
that's about as straight chiropractic as you can get. And chiropractic has saved my life and my brother's and my family members' life, so many different conditions just by adjusting,
mhm,
C1, C2. So, I mean, I'm C1, C2 or chiropractic care. I was under Gonstead care when I was
mhm,
younger. So I'm
mhm,
fine, full spine. It doesn't matter. Chiropractic care has changed my family's life. So I'm
mhm,
all about it. But in regards to laser replacing chiropractic care or different types of technology replacing chiropractic care, I mean, that's a tough question. I would say they're no matter what, they're definitely complementary. Um,
mhm,
like Dr. Joe is saying, it's such a light and gentle, safe
mhm,
technology. Same thing like chiropractic care and
mhm,
adjusting the spine, and
mhm,
They could be used. I use them a lot, and I'm noticing when I use laser therapy on patients that they'll hold their adjustment longer.
mhm,
I don't know if you noticed that, Dr. Joe, like complementing laser therapy with general chiropractic care, that they'll just hold their adjustment or stay in alignment longer. Um, the other thing that was interesting that I noticed in Chicago when doing upper cervical laser, and then I was sending a lot of patients to a medical doctor that did prolotherapy in Chicago. So if they had ligament instability, we were doing digital motion X-rays, seeing the ligament instability. But us as chiropractors at the time, I didn't think we necessarily had a solution for that within our scope, especially in Illinois. So I'd send them to the prolotherapy medical doctors. They would come back, and I'd also notice they would hold their adjustments, and then like any anterior listhesis would be corrected. And I mean, it was like amazing doing the two and two together. So then that's what got me interested in doing the injectable procedures, which
mhm,
were primarily only available for chiropractors in the state of Oklahoma.
mhm,
Um, but I hypothesize now that with certain lasers and the higher powered lasers that we're able to get almost like prolotherapy like changes with
mhm.
using laser therapy. Um, but we haven't proven that yet. But that's something we're working on.
Well, that's fantastic. So, with regards to if I notice much with adjusting and holding, my practice is pretty different than yours. It's not like it's definitely not upper cervical. It's mostly
Yeah.
rehab.
Okay. Yeah, for
It's
sure.
rehabilitation and it's like chronic pain. So whenever I need to use or add in a laser, it's mostly with shoulder and neck.
Okay.
And most of the research that I had been exposed to was demonstrating about the summation of like electrical stimulation with laser and having a beneficial effect associated with that.
For sure.
So, it's not a cornerstone of my practice, but I'm trying to figure out a way to make it that because I
For
can see
sure.
the value of it. So,
Yeah.
and a lot of these protocols tend to really work well with other types of interventions involved too. So, it makes sense that you
Absolutely.
would see that with prolotherapy. So,
Well, and I wanted to jump in another question, because I'm
mhm.
looking at always thinking of our readers and chiropractors. And, I was curious about how many years you'd mentioned, I would think at the very beginning, to go over just laser therapy itself. How many years? Because we always tell we're featuring the latest and the greatest.
Yeah.
Okay. So obviously, in chiropractic, the chiropractic adjustment is, of course, the greatest.
Absolutely.
It's a hands-on healing thing. You can do it anywhere, anytime, and
Absolutely.
got to be a chiropractor. You got to know it though and perfect that art. So to
Hmm.
me, we're always looking for advancements on the latest stuff. So the latest technologies, and of course, safety is always a factor. So to
For
me,
sure.
like something to override a chiropractor might be, okay, if it's newer, then how safe is it? What are the risks involved? And it sounds to me, from what I've been hearing, that it's pretty safe. Now, those are the things,
Yeah.
the risk factors that they should be looking for. You'd mentioned, with certain devices, certain things, but how do you see that with that 20 to 30% of chiropractors using lasers? Then what kind of things or answers or advice would you give them? Because I would think safety would be a big factor, and then the benefit. You know what I mean? Like, obviously,
Yeah.
it's
Yeah.
a
Safe.
it's affordable. So how do
Yeah.
you know what I mean? But then how would you weave that in there on the safety factor?
Yeah, for sure. I mean, we've met many chiropractors. Like I was talking to JR in St. Louis when we were there, and many chiropractors came up to us, and a lot of them are afraid of class 4 because they've had issues where they either saw people get burnt or they had retinal damage because they were messing around and they weren't using the safety
Mm-hmm.
protective eyewear. So I mean, it's a real concern. It doesn't have to be concerned if they're trained properly, especially with class 4s. So I'm not like I said, I have all types of lasers. So
Mm-hmm.
if you know how to use it, they're safe. And then if you know that you're not trying just to do that increasing photothermal effect, like you're talking about, Dr. Joe, we're not just going for the heat. If we're going more for a photobiomodulation effect, where it's a cellular modulatory effect where the laser is actually cool. You could still accomplish that with your class 4 if you pulse it correctly. So you can make it even safer if you know how to pulse it correctly. But then, like with the handheld lasers that are out there, those are super safe. Even if it's required to wear safety goggles,
Mm-hmm.
more than likely you're not gonna. Even the highest powered handheld laser, you
Mm-hmm.
would have to leave it on for a long time before you'd start causing any skin damage
Mm-hmm.
and even repetitive use to cause any retinal damage. So any
Mm-hmm.
handheld laser, a chiropractor should not be concerned about any
Mm-hmm.
safety concerns at all. Any
Mm-hmm.
of the ones that are in the chiropractic space, they're all very safe to use for sure.
Mm-hmm. And then do they have like training? I mean, is it usually unique by, the manufacturer, by whoever you're buying the laser from? Are there courses or classes, like you said, you
Yeah.
recommend? I mean, obviously, that's another question because it sounds to me like even chiropractic, obviously, anybody can go out there banging somebody's spine, but that's
Yeah.
not safe either.
Exactly. Exactly.
So you
That's a
need
good question with the are the lasers different? Yes. I would say you have like 3 to 4 different categories of types of lasers
hmm
and how they're implemented.
Okay.
So I would say whatever laser a chiropractor decides to purchase,
hmm
your best training is probably going to come from that manufacturer for that type of laser.
Okay.
There is some general laser training that's available uh, overseas. That I'd say is probably the best training that's available.
hmm
So look in Germany, look in Italy, look in Russia. You'll find the best laser training available worldwide.
hmm
That could translate to any laser, but yeah,
hmm
they are used differently, and the application is used differently. And one example I could give is so on videos or on pictures, what we see a lot with lasers is where like a laser is being scanned over the area, and especially with this class 4, like a painting technique, it's called.
hmm
And they're using that with a class 4 specifically if the duty cycle or the time on of that laser is on for more than it's off. So then the heat is building up so you don't burn the skin. So they say, hey, just paint over this area so you don't burn the tissue. But the problem is you're dispersing all that energy to an area that you may not need to treat. Like Dr. Joe saying, you have an ACL tear. So pinpoint it over that location. Let's not just treat it, disperse all that energy for that protocol around the knee. And if you do, you're gonna need a lot more energy instead of just pinpointing that exact location. But you only could pinpoint that location if you have the duty cycle lower on the laser, or like the handheld, you could pinpoint very easy. And then you're able to get that dosage of energy right to the anatomical location that you're trying to treat. And that's like one example of if you try to use a painting technique with some handheld lasers, you're just going to disperse the energy and you're not going to get the result you want to see.
hmm
But if you have a high powered class 4, you can kind of get away with it because you're just pumping so much energy, and it's kind of like
Right.
it's a shotgun approach.
Yeah, but you with the handhelds, you prefer a stationary application,
Yeah, we
right?
always teach pinpointing with pressure is ideal with
Mhm.
these handhelds.
Skin to skin, right? Or
Yeah,
skin to instrument,
yeah,
right?
yes, correct.
No
and
space between.
pinpointing specific anatomical locations that will get you the best result with, I
Mhm.
would say, with most of the handhelds that are available
Mhm.
out there.
What yours, I mean, honestly, you mentioned it earlier, and I'm not even, not just because you're here on this with, but I mean, they're perfectly priced for anyone who's working right now and wants to include laser. It's a perfect entry into the
Absolutely.
market, easy to get into. Anyone can do it. You
Yeah,
know, for
safe.
every room or just, you know, one
Mhm.
for the office. But
Well, and we love to be working with a chiropractor who's walking the talk out there,
Yeah,
that's the point.
Ryan. So,
Well,
you
you
know,
were on the cutting edge of this. It's like the photobiomodulation. You know, I saw about your background. You know,
mhm.
and
yeah,
so you are walking the talk. You know, I
yeah,
mean, do you do classes out there, or have you written any books? I mean, I'm happy to have your articles forthcoming, which I hope to see more of. Right
yeah. No, we
on
plan
ACL recovery because I need a good.
yeah, for sure, for sure. Yeah, no, I could help out with that for sure. Yeah,
Good.
we have classes and workshops in the work because we do notice that. So when we were in St. Louis at the Logan Symposium with JR,
Mhm.
so a lot of people have seen the articles, so they knew who we were. So they already had the laser, they already bought the laser, but then they wanted me to show them very specific treatments on how to use the laser to all different types of things, anything you could imagine, you
I want
know?
to see your protocol manual, Ryan. That's what
Yeah,
I want to see.
that's secret.
I know. I mean, believe me, I want to get all this stuff from all of the people we get to
It's
work
like
with.
his
How to develop.
protocol manual is all like redacted,
Yeah,
black,
exactly. Yeah, not for America.
like launch codes. You know, it's like put
Mhm.
here for 3 minutes.
Yeah, for sure.
Well, we've already hit the 30-minute mark. So I didn't want to, I don't want to keep our listeners tied too long, but I wanted to make sure then and invite you if you got any other points in particular you wanted to convey. Otherwise, I know they're going to look forward to seeing you in the American Chiropractor every month and at upcoming events. Are there any events in particular you guys usually want to look forward to seeing people with? Or is it mostly the American Chiropractor they're going to get to find you?
Yeah, mostly the American Chiropractor right now, but we are going to be launching something with another partner company that's quite amazing for neuropathy and nerve disorders. There's
Okay.
been a lot of, I guess, misinformation, I would say, about treating neuropathy and nerve disorders that you're getting minimal results with, but there's something we've been introduced to combining with the laser that's just crazy, crazy, almost like miraculous results. And I only
Mm-hmm.
like promoting things that work and that are affordable. So, because I was practicing chiropractor myself, so I bought a laser for $150,000 in Chicago to do aesthetic treatments, and it definitely didn't give me $150,000 aesthetic results for our patients. So just
Oh
because it's
no.
priced that high doesn't mean that it's going to work either.
Well, we're hoping it wasn't somebody you found in the chiropractic space. Just
No, no, it wasn't. All
see,
those are good.
there you go.
I've heard of those lasers though. I had one guy tell me about like a weight loss one that was like, you know, you need a degreasing pan underneath this laser for how.
For how well it works. Yeah,
I
yeah,
was like, that's really important.
that's
I'm
for
not sure if
sure.
it's
It all works
regulated.
either from a marketing standpoint to attract the patients who you might never see. So I'm like, you never say never, but the main thing is you just want to make sure you're using the best equipment, the safest, and the doctor,
Absolutely.
and you're working with the people who know how to teach you how to use it properly. So Dr. Ryan, we're so glad we get to work with you and meet you and keep following your journey and learning along the way. And
Yeah, thank you so much for having me. I appreciate it. Nice seeing both of you as always.
Thank you, Dr. Ryan Novak, for joining us today on TAC Tic Talk. Remember all the listeners to subscribe to our podcast online on Spotify or Apple or Amazon, and look for us in the pages in the upcoming months.